Drooling is a common complaint of majority of patients with Parkinson's disease. Patients with Parkinson's disease have reduced movements of their muscles. The muscles inside mouth that control throat and tongue are also affected, which results in difficulty of swallowing. Thus, patients with Parkinson's disease are unable to swallow their own saliva, which is found normally in mouth, which results in drooling. Also, patients with Parkinson's disease have a bad posture, which causes their head tilting forward and downward, which results in accumulation of excessive saliva in the front part of their mouth, subsequently resulting in drooling. Drooling is present in more than 75% of individuals with Parkinson's disease. Initially, drooling may be present only at night time, but later it may become a problem in the daytime as well. Excessive drooling may lead to aspiration of your saliva into your lungs, which may result in pneumonia. There are many different types of medications which can be used to help drooling. Adjusting the dosage of medications used to treat Parkinson's disease may help reduce drooling. Most of the other medications work by decreasing the production of saliva. The medication used to treat drooling in Parkinson's disease may include amitriptyline, which is an antidepressant and causes dry mouth as a side effect; trihexyphenidyl, which is an anticholinergic and also causes dry mouth as a side effect; atropine drops, which can be instilled in mouth few times daily; scopolamine patch, which can be applied behind the ear every 3 days; botulinum toxin injections, which can be injected every 3 to 4 months. You should keep in mind that these medications may have some side effects as well. Botulinum toxin is a neurotoxin, but when used in small doses, it helps drooling. It is injected into salivary glands which produce saliva. Botulinum toxin reduces the amount of saliva produced by salivary glands and consequently decreases the amount of drooling. Most of the saliva in our body is produced by 2 glands, including parotid gland and mandibular gland. The treatment with botulinum toxin is more effective when both types of glands are injected. Effect of this treatment also depends upon the degree of drooling. Usually the benefits of treatment are more pronounced when the amount of drooling is less. As the amount of drooling increases, the effectiveness of treatment decreases. The dosage of botulinum toxin can be adjusted depending upon your condition. The effect of botulinum treatment is temporary and the injections have to be repeated every 3 to 4 months. Botulinum toxin treatment may also cause some side effects, including excessive dryness of mouth, increased difficulty in swallowing, and pain at the site of injection during the treatment. Furthermore, a long-term decrease in amount of saliva in the mouth may cause dental caries. Thus, periodic examination by a dentist are necessary if a long-term treatment is required. There are several steps that can be taken in order to reduce these side effects. Initially, the treatment should begin with a lower dose and should be applied to the parotid glands only, since they produce less saliva. If the drooling does not improve, a higher dose can be used. In refractory cases, surgical treatments such as salivary gland duct ligation, relocation, neurectomy, or removal of gland may be required. Due to decreased spontaneous swallowing, the saliva pools in mouth, so you have to remind yourself to swallow frequently. Also, chewing a gum helps induce automatic swallowing reflex that is decreased in Parkinson's disease. Also, you will need to keep your posture straight, so your head is not tilting downwards. Therefore, you should pay attention and correct your posture frequently once you notice that it is becoming a problem. Additionally, you should practice keeping your lips closed when not eating or speaking. You should also avoid foods with sugars because they cause extra saliva to be produced. Keeping a handkerchief is also important as you may need to wipe your mouth frequently. This information is provided for educational purposes and should not be used as a substitute for the advice of your physician.